Hi, this is Bobby Kimbrough, and welcome to Off the Cuffs. Today, I'm very excited. I got Dr. Ohl here, who is an infectious disease expert based right here in Forsyth County. I'm very glad to have you to the show, Doc. I really appreciate you taking time because I know your schedule is very busy during these unprecedented times, but welcome.
Well, thanks. It's really great to be here. I've been looking forward to it.
Wow. You know what? You made my week. So tell me something. Tell me a little bit about you. How did you arrive here in Forsyth County? I mean, you are internal medicine at Bowman Gray, correct, Baptist?
Well, yeah, I'm infectious diseases and internal May at Baptist Medical Center in Bowman Gray, and some people still go back and forth between the words. I'm sure the Gray family likes the Bowman Gray name.
I'm sure they do.
But yeah, so it's been kind of a long road a little bit. I was born and raised in Wisconsin, and northern Wisconsin, where there really is winter still. And I went to medical school in Madison, Wisconsin, at the University of Wisconsin. And I was a what was called HPSP, Health Professions Scholarship Program student. So the Navy paid my way to go to medical school, and then I went to do my training in internal medicine and infectious diseases at Bethesda Naval Hospital.
Wow.
And then paid back time. I thought I'd be in for my payback time of 4 years, and I spent 27 years either active duty or in the reserves, 13 of it active duty up in the Bethesda area or in Japan or other various places. And then I wanted to stay and do some stuff in academic medicine and medical schools, and I saw that Greenville was looking for a faculty position, so I went down there for 3 years, East Carolina, and loved North Carolina.
God's country, but yeah.
It really is, man. Yeah. There's something for everybody here. And then they recruited me away and stole me away from ECU to come here to Winston-Salem in 2000. I've been here ever since, and I've lived all over the world, and this is the best place I've ever lived.
Wow, well, thank you.
I'm real happy.
I'm glad they stole you away and brought you here. You and I were talking offline, and we were just sharing some stories about living in D.C. You lived in Japan or spent time in Japan where you were in the Navy, right?
I was, but I also did some. I still have affiliations and friends and colleagues there, and in the infectious disease world, and we're kind of comparing notes on COVID-19 and current outbreak and what's going on in Japan and what's going on here, and so it's almost a second home.
So let me ask you a question. A lot of experts out there, from the White House all the way down to a few drink houses, everybody got an opinion on what and how and what we should be doing. I like the word that I heard you say this morning, personal distance, the word you use.
Right, yeah.
I like that. So a lot of people are asking the questions, where are we in this pandemic, this virus? Do you think that it's time that we kind of try to start to return to our new normal? What do we do? What should we be doing now? A lot of people are panicking, don't know what to do.
Right. Yeah. So I like the terms "new normal" because so we've kind of gotten through a wave in this outbreak here in the Triad area. We've been kind of lucky, and our outbreak hasn't been nearly what it was like in some other urban areas, like even here in the States, Charlotte, or to some extent the Triangle. A little hard to know day to day how the future might go, but I think it's time to start thinking about how we're going to get back to a new normal. And I like to talk about we want to do this. I call it relaxation rather than release. Release is like you're free to go, right?
Right.
This is relaxation, so we want to ease into our new normal. And when we do this, we need to be cognizant that the virus isn't really totally going away. And so we still have to do some things to keep ourselves safe and our loved ones safe. Now, for most people, the virus is, it's going to cause a kind of a nasty flu-like illness. No one likes being sick, but
right.
But for a certain segment of our population, people with underlying health problems and the older people, they're more vulnerable, and we want to try to protect them. So we want to form a cocoon of safety around our people who we all care about and who have more concerns. And so we still are going to be needing to do some personal distancing. That doesn't mean social distancing. Social distancing would not mean contact with people.
Right.
But there are so many ways to be in contact with people now that don't require personal interactions and closeness. Of course, your family is fine, but outside of that. So I think we're going to be relaxing in a phased sort of way. More to come on that and see how that goes, but open up things that are a little bit safer first. And some of our small businesses that have really been struggling and trying to do some things to find something for our kids to do, which is really important because they've really taken a big brunt of this because the kids are social, man, and we're asking them to do some things that are hard. And so we'll do that in the first phase, and then start to bring back some of the larger workplaces, and even in the sheriff's office, maybe things can get a little bit more back to normal. And then as we move on, if each phase goes okay and we don't have a resurgence of the infection, then we can open up other phases too. But I don't think we're going to be totally 100% normal for some time because...
when you say for some time, I've heard people say that. I was watching the news the other day. I've heard talks of people saying that we won't be nowhere near where we used to be in terms of sporting events, crowds, and things like that for several months.
Yeah, those things I think are going to be tough for a while because it's bringing those people really close together in those crowded areas are some of the more riskier things to do as far as transmission of a virus from one person to another. So it may not be quite the same football season this fall.
Well, that's what I heard. I heard talks of that in some of the circles that I move in and out of, and they was talking about possible football schedules, how a lot of things are going to be altered if there is football scheduling this year. But I've been seeing a lot of movement, a lot of people doing different things here in the Triad, especially here in Forsyth County, where we're going to blanket or should I say mask the city and the county for the next 40 days, asking everyone
mask the city,
when they step out in public to don their mask. What's your thoughts on that?
Well, we've never done this before, so
never.
I don't know exactly, how much it'll mitigate or make us safer. I think some, definitely some, particularly when you're inside in places where the personal distancing might be a little harder. Mm-hmm. So it's courtesy. It's being comfortable and polite for other people because they may be a little worried. They may be a little scared because they're not sure. So if you're in these inside areas particularly where it's hard to personal distance, like a grocery store on a Saturday afternoon or places like that, then masking I think is going to be helpful.
So if I'm out by myself, riding my bike, walking by myself, do I need a mask on?
Not really. When you're outside exercising and doing things outside. Now there's some greenways and other beautiful areas in the city which people enjoy where it can get a little bit crowded on the weekend. Those areas might be a little different. So
just some crowded spaces.
But if you're out riding your own bike, the air is blowing and the sun is out and those things are all disperse the virus. UV light from the sun actually kills it. It takes a couple 3 hours, and then the higher temperatures and humidity make it hard. So outside, it's all dispersed out. It's really not an issue. So all of those outdoor activities are very safe.
UV light kills it.
Yeah, it can. Yeah, it does. I mean, the stronger the light, the better. And so I think as we start to relax things, some of those outdoor activities would be things that we would really relax first. A lot of them already are. But for instance, basketball courts and places like that, getting the hoops back up and places, maybe even some of our kids' playgrounds, as long as they're not real crowded. Other things we could possibly do. Bad time to have allergies, by the way.
Yeah.
But
drink water.
Other things that could be, opened up kind of early on would be places where there's just not as much
Give me an example.
distance. So, like, let's say you got a restaurant. You can get the restaurant with the tables apart further.
Right.
And so people are sort of personally separated a little bit, and the number of people is down. So the big thing is population density. So you try to disperse out people and have less density of people in areas, and it just makes it safer. And then if you're in that area and you're masked, then it even makes it safer yet. Now, it's a little hard to eat with the mask. Yeah. I've been trying to figure it out. I haven't conquered that one yet. But so you go in, and while you're in the spaces or in the elevator or wherever places in the restaurant, you're masked, and then you sit down at your table, and then, the waiter comes masked, and then when the food comes, you can put down your mask and eat. And
what about movie theaters, every other row?
Yeah, well, maybe every other row is one way to think about it. That's probably going to be a little later down as we open up. Yeah. But yeah, I mean, you're thinking the right way, is that there's always a way to use a little bit of ingenuity and to try to figure out some way just to make the system safer. Some things it's going to be really hard to do.
I think if I hang around you a little while, I could be your assistant.
You could, yeah.
I could,
maybe I could assist you.
No, you could swear me in as your assistant on this infectious disease.
You could be my ID deputy.
Yeah,
right,
yeah. Matter still, I need to call D.C., call the White House and see, can I get you up there? I know you were saying you knew Dr.
Fauci.
Yeah.
So, I trained under him for a while when I was up in Bethesda. He was at the NIH, and I was with the Navy, and so we spent some time together. Sharp guy.
Yeah.
When he talks, I listen, and he's a perfectionist, which in infectious disease is really important.
That's impressive when another doctor expert says, when that expert speaks, I listen. That means you have a lot of respect for him.
I do. Yeah. I can't think of one infectious disease doc in the country who doesn't respect Dr. Fauci.
Wow.
He's been a great leader for us. Yeah.
So we need to take his advice then, huh? That's the guy we need to be listening to then, huh?
He knows what he's doing, and he's got a small army of people who are also bright and sharp that help him gather information and look at studies and data and figure out.
Have you ever seen anything like this before?
Not like this. I have not. Now, I've been involved in other public health emergencies. In the Navy, I've been involved in control investigation of outbreaks of tuberculosis on an aircraft carrier.
Right.
And, these ships are very close, as you've seen from the cruise ship problems.
Exactly.
Yeah, ships are a place where things can get transmitted fairly quickly. And then, other small outbreaks here and there. And then a lot of people don't even remember. But we all lived through a pandemic not that long ago, 2009, the swine flu.
Right.
That was a pandemic.
Yeah.
It crossed everywhere, and it was all over the world. And we got us all through that one. But my real first immersion in public health and community response and trying to help a community understand what they're going through was Hurricane Floyd in eastern North Carolina, because we in September got hit with 26 inches of rain in eastern Carolina, and it inundated our power areas, and so we were without power for 3 weeks, 4 weeks, and not unlike some of our more recent hurricanes that have really been devastating. Lumberton, for example, severe flooding. And
it's down near Kimbrough.
Yeah, exactly. Yeah, people were scared. People didn't know what to do, and every night I went down to the TV station, and people were able to get a generator for their own TV and said, here's what to do with your food, here's when to throw it out, when here's not. And I said, most of you in Eastern Carolina, you've been camping. This is just camping on steroids, so to speak.
Yeah.
And just to help people get through it all and be safe. And we didn't have any big outbreaks other than a little bit of flu in our shelters. But so we got through that one. So that's where I kind of got interested in helping communities in outbreak response.
So let me ask you a question. So once we get through this wave, do you think there'll be a resurgence in the fall, in the winter, or do you think we'll have a system in place to sustain that?
Yeah, boy. Okay, let's get the crystal ball out. It's a little smoky.
A
little smoky for the fall. Hard to know, but I think it's more likely than not that we might have another wave. How big and how high, it's a little hard to say. Usually respiratory viruses start to come about, in the fall and late fall and early winter. This one might be one of those. So what kind of worries us a little bit is and Bob Redfield from the CDC said that, if it comes at the same time that flu comes, then it's going to really be hard, particularly for healthcare areas and hospitals and such, because our admissions go up anyway during flu season. So we might have a double punch there.
So I got to ask you the question that everybody asks me all the time. But before I ask you the question, as relates to medical professionals, doctors, first responders, just everybody, I just want you all to know how much I appreciate you all, first responder doctors, those that are fighting this unprecedented, this invisible enemy that you guys are fighting. I applaud you for what you're doing. I hear all the time, one person can't do everything, but everybody can do something.
Right.
And so
I agree. Yeah,
I applaud you for what you're doing. I've met a lot of people in my life. I got to put you at the top of the list in terms of intellects. But the question that I've got to ask you is this. People ask me all the time, they say, well, Kimbrough, is the sheriff's office ready, or can they handle what's happening now? In other words, are there systems in place should something happen in the detention center, should something happen here? Are there systems in place? So I guess the people that are watching probably want to ask the question, is our medical facilities able and equipped to handle what may be in the crystal ball, even though we don't know? Can we handle, are we at a place to where we have systems in place that can take care of us?
Yeah. Well, first of all, thank you for the kind words.
Yeah.
I could say the same thing about our people protecting us and our first responders. I think we are. I think our hospitals are ready, and our medical system is as ready as it can be. I'll be quite frank. That this outbreak has exposed some areas in our healthcare systems which needed some patching up for quite some time, and not just in outbreak response or things, but in everything from insurance and third-party payers and affording healthcare. Access to healthcare is huge, and we've been wrestling with that anyway. There's certain socially, economically disadvantaged people and people of color in certain areas that have trouble with access to health care even when we're not in an outbreak. And those have been challenges, yeah.
You also took me into a question, but before I go to that question, you said something. You said that this outbreak, this pandemic has exposed some areas that we need to work on, that this pandemic has exposed all of our systems to some areas we need to improve on. I can be transparent and say that from sitting here at the sheriff's office, there are some things that this pandemic has caused us to look differently in terms of how do we disperse manpower, how much more manpower is needed, because you can't plan for something like this. However, should an event like this happen, which has happened, it would be nice to say, okay, we got everything we need in terms of manpower, because what I see and what I saw happening in New York, the number of people that are going down in the facilities, hospitals, first responder, there are some communities that could not function if they took a hit like that. They would really be down on their knees requesting help from outside counties and municipalities to come in and help. But as you said, we've been fortunate, we've been lucky, we've been blessed. And I hope we take this learning experience that has happened not only here in this county, but around the world, to make us more ready or preparedness for what may come down the road in the fall, what may come in the winter. But you touched on something as you were saying. You talked about how certain populations have been affected, or it is affecting them differently. So we know that. I was watching television last night. That's known. That's a given, as they say. That's the obvious. And so my question would be that if we know this now, how do we, going forward, how do we slow that should this resurgence take place in the fall or the winter that we don't have across the country or even in this triad area of the county, a population of people who are dying at a higher rate?
Yeah. So, man, that's a good question. And it comes down to responses at several different levels, and some of those are things that are trying to fix the underlying problem. So I'll just use as an example. COVID-19 or the viral infection in homeless people is harder for us to manage. Sheltering in place, being at home, isolating, doing contact investigations. So, we've really had to respond to that, even though there haven't been many infections in that population, but we have to pay attention to it. But it comes down to some really fundamental problems. I mean, this outbreak didn't cause the problem of homelessness. And the solutions may not lie in the outbreak response, but above and beyond. And so our county's really done a great job, actually, in setting up special shelters and areas for people who are either with symptoms or have been known positive by testing for COVID-19. And so in some way, we did solve some of the homeless issues by putting some resources into that. But we also use basic tenements of outbreak response and controlling epidemics. But I think the first thing is engagement. I mean, I think these communities that could be hit harder and suffer more, we need to have an engagement with them and really create areas so that there would be greater access to care, greater access to prevention. But some of the problems are very fundamental. So if you have people who are working in our areas that are important and they can't stop doing what they're doing, food production, distribution, truck drivers, the petrol plant doing refinery work and things like that, we need to find ways to engage and get in there and make their workplaces safer and help their companies and the people they work for take better care of them in areas when there's communicable diseases. But it's also looking at their living situations, better housing, with overcrowding, and those problems are a little bit harder to solve in a short period of time. But it's again, we learn where those gaps are that have been exposed by this, and then maybe hopefully we can respond to that with some public resources and government and even faith-based operations. I mean, everyone can kind of find a way to help with those things, but the solutions aren't as easy. But the first thing is identifying where the problems are, and then engagement and access.
Doc, you're pretty sharp. Me and my buddy got a thing, growing up, we used to say 360, right? 360 mean that person is pretty sharp. That means they've completed the circle of they pretty sharp. You're sharp. You're very, very, very intellectual.
Well, thank you. Yeah.
You and I was talking offline, and I was saying what drives a man to go into a discipline like that, infectious disease, and you said something that still runs through my head. You said the quest for knowledge.
Yeah.
Yeah, the quest for knowledge.
Yeah, that and then also the quest to help people and be with people.
I like that.
And infectious disease brings all that together. I like the microbes and the biology and the immunology, which is our host response.
Yeah.
How we fight infection, and it puts it together with being a doc and working with people and helping people on all different levels, personal and in a community.
So
it's been quite rewarding for me.
I'm glad you chose that discipline. You have been very instrumental in fighting this pandemic here in this county. I got maybe a couple more questions for you. One is that a lot of people are wanting to know where do we go from here? A lot of people don't know where to go from here. This is a totally new normal for us, unprecedented times, and people are lost. I was watching the news last night, and I noticed that there are a lot of mental health issues to the point to where people are actually doing therapy and mental health treatment through video-comm online and counseling online. This totally new, uncharted water. It's almost like we're flying a plane as we're building it in the air. The plane is in the air and we're adding parts, we're building it as we go along. And so a lot of people that are watching and that are going to be watching, that are watching now, are going to want to know, where do we go from here? Do we know where we're going? What should we do?
So I think we do know where we're going. it's kind of like when you're taking a trip, taking a trip to Chicago or my home in Wisconsin.
Yeah.
You know where you're going to end up, and you know where you are now, but you just have to plot your course. That's the tough thing. So where we're going to end up, so eventually where we need to end up with this is with some good vaccines, and we need to get that vaccine out and deployed. And that's going to take an army of public health people. By the way, I want to put a plug in for our county health department here.
Oh, yeah,
they've
awesome.
been doing a phenomenal job in our area. But and so the roadmap basically is going to be to continue to prepare for another wave when it happens, and to be ready and have what we call in medicine surge capacity. So when those surge of cases can be handled in a safe and effective way. But also to do some of the other things that we want to do and need to do. The economy needs to get going again. People are out of work. I mean, that's real. People are getting furloughed. Trying to make your house payments.
I've heard a couple of restaurants have closed up, went under.
So we need to be supportive of everyone and everyone in our community. We're all in this together, and we need to work through it. And I think that the economy can be reopened. Will it be exactly look like it was 6 months ago? Probably not. But let's give it our best shot to get things. I mean, and people might have to change a little bit what their work or their profession was, but and I think there's safe ways to do it, and we just have to keep that in mind. And always ask yourself, what's the safe way to do this when there is still a virus still present in our community? And once we got everyone vaccinated, or enough people have had the infection, then we can start thinking about going back to the way things were. But we've learned a lot of things that probably won't go back. For instance, how many conference calls have you done by WebEx or Zoom or whatever? I can't even count them.
Every day, can't even count them.
And it works.
It does.
It does, and it's probably more in a way of a lot of business travels, and maybe they won't need to travel so much. And
I miss those though. I'll tell you why, because I love going to meetings where I can see the people, see the participants, because then I can read them a little bit.
Well, we're old school that way.
Yeah, we old school.
Yeah.
Those conference calls where you be on, a guy could be on the phone, he could be throwing rocks. I don't want to hear it, but all you hear is his voice. But I get it where we are, but I prefer to be looking at a guy.
I do too. I'm not saying it's going to take over.
Yeah,
but
I hope
it's the same thing as in education.
Yeah,
I've heard people say, wow, look how we're teaching now. We'll never have to have in classroom instruction anymore.
That's crazy.
That is crazy. That is totally crazy talk. For one thing, it's not as effective. It doesn't work as well. It's a stopgap when you have to.
Right.
And the other thing is that not everyone has the capabilities to do that kind of learning. Either their brain doesn't work that way.
That's true.
And they need that, personal instruction and contact, and to say, hey, that's really cool, or that fire that comes from a really good teacher. And then also there's some households where, because everyone's working and this and that, there's not as the access to the equipment, or it's just not as a structured environment. And so, again, there's, I think, populations that are being left behind a little bit.
Of course.
In the way we're doing our education now. So we do need to get our schools up and going again. I'm afraid this year might be a bit of a wash.
Yeah, I'm pretty sure this year's a wash.
I mean, they're already planned out our virtual graduations and such.
This is a wash here.
But coming up this fall, we need to figure out how we're going to do our school in a way that is more effective.
Because you figure May, June, July, so in 95, 100 days, it's time to go back to school.
It's time to go back to school. Yeah.
And
so I think, I know they're talking about how to do that in Raleigh, and there's infectious diseases and public health advising them. It may not look quite like the classroom did before, but I think we can do it. I think we can pull it off in a safe way. Now, does that mean Wake Forest football team's going to be on the field? I'm not so sure, but I'd like to see Wake Forest up and going again as a university in our community, and President Hatch and others are talking about how to do that. And same thing with Winston-Salem State and A&T in Greensboro, and all these places are trying to figure out how we're going to do this. But there's a lot of sharp minds. There's a lot of ingenuity.
There's a lot of brilliant people in the triad.
And it just to relate something here, a teacher told me some time ago that when you have outbreaks and viruses and emerging infections and these new things to come up on you, like we have with COVID-19, that the virus has its tool as genetics and evolution, and it can change itself and move around, and that's how it gets into a population. But we as humans, we have the battering ram of technology and ingenuity and wherewithal, and that's how we beat these things, and that's how we'll beat this one too.
So, you know what? You just took me somewhere else. So, what would you say, based on your expertise, can we backtrack this to where this originated from?
Yeah, I think we got an idea. And there's a lot of conspiracy theories about it. But so if you look back at previous outbreaks of this kind of virus, they've come from animals. So SARS, which was almost 20 years ago now, came from a bat and then got into a population of what looked like raccoons in southern China. And that turns out that people eat that. There. And so that goes to market and it gets butchered. And then it got transmitted to humans. And there was a mutation somewhere in there that made it easier for a human to catch it. MERS, which is another one of these coronaviruses that came up in the Middle East, turns out comes from camels, of all things. And this one looks like it probably came from a bat originally, at least when you do its DNA fingerprinting, right? You got a good fingerprint, you know kind of where it may come from. So you do the RNA fingerprinting in this case. It looks like it came from a bat, but probably through an intermediary animal of some type that was involved in as a food source. So, people get into conspiracy. Oh, it was released from a lab or this and that. But you know what? Nature comes up with these things on their own to challenge us. And it's not, for instance, influenza, for maybe 300-400 years, it's been a human infection too. But before that, it was an animal infection.
Right.
It came out of pigs and chickens. And
I saw where they had the first animal canine that was infected in New York. I saw that several weeks ago, where someone's pet had been infected with.
Yeah, I saw that report on the dog. I'm
saw that
totally
too, huh?
convinced. Now, cats are a little different.
Yeah.
Cats can pick this up. Dogs, it's probably pretty hard.
Cats can pick it up, but dogs is pretty hard.
Yeah, I think it's pretty hard. So this virus actually mutated at some point. We kind of know when, probably somewhere maybe between October and December of last year. And that mutation made it easier to attach to a certain receptor inside our lung tissue. So if you inhale it, it would be more likely to attach and cause an infection. And then there was one other mutation that allowed it to be released from those cells easier to give it to another person. Okay. And so this is what gave us this human-to-human transmission capabilities of this virus. It's basically just small mutations in the.
What about my parrot? If I get my parrot, will it kill me?
Your parrot?
Yeah.
You stumped me there. I don't think birds get this.
Okay. Good.
No, I don't think birds get this. What kind of parrot you have?
I don't have one.
Oh, you don't have a parrot.
I just thought of that.
But you just pulled it. Yeah. So, but yeah, I think parrots are okay. But yeah, there are some animals that can get it. I think dogs are pretty resilient in this one.
So I got one last question for you.
Yeah.
So when people are out now, right, and I'm out, if people are keeping their personal distance, that's the word we're going with?
Yeah.
Our personal distance, do they need a mask on? So if I'm standing in line at Home Depot and everybody else had a mask on, do I need one on if I'm keeping my distance?
You know, what I would do for a politeness reason and things, inside, have a mask on. Outside, take it off.
Okay.
And
inside,
unless you're in your own car, obviously,
right.
or something, or in your own house.
So I'm gonna tell people I talked with Dr. Ohl, and he gave me the authority to say if you're inside, I don't need it, but if I'm outside,
no, other way around. If you're inside, you need it. If you're outside, you don't.
Okay, if I'm inside where people are,
right,
I need it.
Yeah.
But if I'm outside,
out and about,
no.
No. You don't need it. There's one other place where you need it is that if you're sick yourself,
Right.
then you should be using it at home, so that your spouse and your kids and your grandmother don't get it. And you should try to isolate yourself a little bit in one part of the house. So may mean sleeping on a couch in the guest room or someplace for a few days. But generally we say 7 days. So 7 days of isolation, and at least 3 days of that feeling better, and then you can come out.
I feel like I've been to medical school, man, for the last 30, 40 minutes.
You want me to give you the test now?
Yeah, give me the test. Give me the test. Yeah. Well, you know what? I want to thank you for coming. I appreciate what you do. I want to thank all those unsung heroes, people that make it happen every day, regardless of what you do, whether you're praying for us, whether you're working in the community, whether you're working at a restaurant. I appreciate everyone who's doing this. And I want to use the analogy that you gave as we go and close out. You said that, even though we know where we're going, we chart the course, we're here, we're charting the course, we're on this journey, we're going to get there. There may be a traffic jam on the way.
Or a detour.
The weather may slow us down. There may be a plethora of things that slow us from getting there, but at the end of the day, we will get there.
We'll get there.
We'll get there.
And we've started our journey.
That's right.
Yeah,
I like that. I appreciate you for stopping by, and I do mean that when I say you're at the top of my list. Very, very intellectual.
Well, thank you.
I appreciate your time.
all the kind words, and I'll share them with my colleagues.
Yeah, thank you very much. And as always, this was Bobby Kimbrough with Off the Cuffs, and thank you for joining us.